Okay, thank you guys all for joining us tonight for our conversation on cancer, pelvic health. We're here tonight with Lauren Mansell, who is a physical therapist and pelvic health
Specialist.
What the word is escaping me, Lauren.
Yeah, pelvic health specialist or physical therapist, whichever.
Pelvic health specialist. Lauren, you are welcome to take it away. Who better to introduce yourself than yourself?
Well, welcome everybody. Yes, I actually have a slide on me, of course, because I made the slides. So welcome. I just wanted to post the agenda so everybody kind of knew how to get the most out of tonight's discussion. I'm really glad that it's recorded. So if there's any questions or concerns, we'll head through a few slides so I can give you guys a bunch of information, and please feel free to type in any questions or clarifications that you want in the chat box. We'll run through the presentations, end with a little bit of seated yoga, pelvic yoga, because we've been hanging out talking about some heavy stuff. And then we'll go back through the presentation, answer all your questions and concerns, and hopefully close with a little bit more yoga. If anything gets cut out, that's what'll be cut out. So welcome everyone. So this is pelvic health before, during, and after cancer care. And what I want to go through is why me, or what is physical therapy and things that we can do to help you. We'll go through oncology related dysfunction, lymphatic function, and also lymphatic dysfunction, how we improve our lymphatics, because it all ties into pelvic health, and how ultimately can we improve our pelvic health. So I am so grateful that each and every one of you is here tonight. I'm a physical therapist. I have a bunch of initials, so I just kind of like to describe them. I'm a licensed physical therapist. I have a doctorate in physical therapy. I'm a certified lymphedema therapist. So that's where a lot of the oncology and oncology related issues may or may not come in. I'm also a pelvic rehabilitation. I have my professional certificate, and I'm a certified yoga teacher, because patients don't like to do homework, but they love to do yoga. So it works really great to help improve our wellness by doing some yoga. I have a few publications. I've been very, very fortunate to be published in Multidisciplinary Care, Surveillance During Cancer Treatment, and then I also have breast cancer and other reproductive cancer protocols that I've created. So that some of the slides we go through it just because those are my passions, and we're all here, and I want each and every one of you to advocate for yourself and know that these resources are out there for you. So what is multidisciplinary care? This is when you have a whole army that's surrounding you and helping you throughout this journey of cancer care. And this slide was actually an altered slide from a presentation that I gave in Paris, France, of all places. It was amazing, for surgical oncologists. And it was really discussing, how surgical oncologists can help improve their patients' function by bringing in physical therapy or a rehab professional. Rehab, one thing that I talk about a lot is that it's my job to help treat the effects of cancer treatment. And I want to start doing that at diagnosis, or as soon as possible. So surveillance or prehabilitation, but I like surveillance better, because some insurance companies don't like the word prehabilitation. Surveillance programs during cancer treatment is really what we're going for. It's truly the gold standard, but only 2% of cancer survivors are getting this type of care. And what that means is, when you have a diagnosis, we measure you as your physical therapist. We measure you, or your rehab, and we'll talk about other rehab people. Your rehab professional measures you, so we know what kind of baseline you have. So we make sure that you get back to that, or you're even better after your cancer care. So I'm very, very passionate about this. And I think, it's your right, it's your insurance during, when we're going through cancer care. These are big insurance years. So your out of pocket and your deductible is going to be met. So you might as well bring us in, and we're really helpful. We reduce a lot of comorbidities, which is other issues that are occurring because of the cancer treatment. We can reduce rehospitalization rates, cellulitis, all sorts of great things that we can do when rehab's brought in. And your rehab partner can be PT, it could be OT, it could be speech for some head and neck cancer patients. But also we want to talk about bringing in dietitians, acupuncturists, and social emotional supports, like the supports you're getting through Awesome Gilda's Club, right? So PTs and OTs are we're similar. We're good friends. We just kind of focus on different aspects of rehab. With rehabilitation, this is my job when I'm working with patients who are going through cancer treatment. And I really want to make sure that we are making great recommendations for you for your function before, during, and after treatment. Surveillance we just talked about. This is where I want to measure you before any kind of operations or interventions. And I want to start talking to you about how is your nutrition? How hydrated are you? How are you feeling? What kind of supports can we bring in for you? What kind of activities can we do to improve your physiology? What kind of modifications can we do to make sure you're staying as functional as possible? And I'm really big about talking about bowel, bladder, and sexual function, because those are very important facets of our life that improve our quality of life. What's really cool about perspective care is that we can actually prevent issues, specifically within our lymphatics. And I want to make sure we talk about lymphatic function because it is such a big deal within bowel, bladder, and sexual function. Lymphedema is another word that's really big, and it's really scary for cancer survivors. And I very rarely use the word lymphedema because I prefer lymphatic dysfunction, because I don't want anyone, either a patient or a physician, really looking for a swollen limb. We know the swelling and congestion can be anywhere, like in the pelvic floor. So, we really want to stay away from lymphedema, because that term makes people think swollen limb, and it can be more central, and it could be swelling in other areas. So I do a lot of pre and post either surgical or intervention education. And again, these are all of the ways that I want you to feel empowered and really like you have at least a little bit of a choice as to what's going on during your care. This is so important. I know that if you're a person who's reaching out and going to a really awesome presentation at Gilda's Club, you probably are pretty well aware of the fact that cancer care is highly traumatic. And it truly is that moment of, oh my gosh, my life is going to change really quite drastically because of this diagnosis, or it could be changing quite drastically. So it's really important for me that as a medical provider and a rehab professional, and when I'm talking to students that I'm teaching, other rehab professionals, that we really keep in mind how traumatic this is. And especially, we'll talk about it in a moment, but when there is increased levels of pain, and how that brings a lot of fear and a lot of, oh my gosh, maybe the cancer's back. So it's something that, and you guys could teach me about this, how you're in cancer treatment and you have all your resources, and then all of a sudden you're discharged from that really intense phase and that you were just trying to get through. And then you're like, oh my gosh, what just happened? Like, it just like hits you, right? So that's where rehab, that's where we want to be, because that's the time that we want to help you getting back to that measurement that we took at the very beginning. besides some of the work that I do within pelvic, oncological, and lymphatic function, I do a lot of teaching on trauma-informed care. And for this, I just really want us to be mindful of the fact that it is my job as medical provider to help you feel safe, to give you choices, which helps you feel more in control, to create connections and resourcing for you, and then helping ways to help manage those emotions that are just really natural and really a part of what's going through. I love creating mantras with my patients. And those are kind of like you are safe, you are supported, and you have choices. And you may choose to, come in and do PT or not. Like, it's totally cool. If that's the choice is, I don't want to do this, cool. Or if you want to do certain aspects of what we're doing, pardon me. Please take him. My son and my dog just came in. Need to go. Dad will be home in a second. Oh, okay, you're fine. Come, if you're scared, you can sit here. I just talked about this a moment ago. The thing that I see time and time again, and the thing that I feel like I have to tell other physical therapists who may not even be, specialized in cancer treatment or understanding of trauma-informed approach or trauma-informed care, is that when there's pain, a lot of times people who've been through cancer, that fear of the cancer is back is huge, and it kind of derails us. One of the other kind of facets I wanted to touch base on was that when we start having those stress responses, it shows up in our pelvic floor, and we can start to see more pelvic floor dysfunction. And we'll talk about that in a little bit, why that's happening. So I just really want, you to be like, the medical supports, we are here for you. And I think, sometimes I've seen, everyone's been surrounded by really amazing medical care. And then, to get you through to like attacking and getting rid of that cancer. But then, sometimes I feel like we can use a little help within medicine on how to deal with the aftershocks of cancer treatment. So this is why I feel like every cancer patient deserves their own PT, and I'm passionate about this. I'm passionate about getting you to feel as good as possible and to kind of break down what's going on with, a pain that brings back cancer when that pain was clearly not cancer. But just knowing this is a very real response. So this is kind of heavy, and it's kind of stores up tension in our bodies when we're talking about these things. Go ahead and find your space. Maybe if you're sitting in kind of an awkward position, take both feet and put both feet right on the ground. Sit nice and tall in your chair. Maybe you have your palms up on your legs, on your thighs. And notice how that helps bring your shoulders back, the head up nice and tall. Notice how you feel in your space. If you're feeling safe, you have a 7-year-old coming in to telling you he's scared because husband had to run somebody to an appointment. Just notice how you're feeling. Notice how you're breathing. Are you breathing through your nose? Are you breathing through your mouth? And there's so much that we can do with how we breathe that then calms down our nervous system and helps us heal better. And these are tried and true ways. So I want you to put a hand on your chest and a hand on your abdomen. And as you're starting to take note of where the air is filling in your body, you start to notice which hand rises up a little bit more than the other. Or maybe what kind of coordination they are lifting. As long as you're not congested, try inhaling and exhaling through your nose. And start to think of filling the belly, nice big belly on the inhale, So the belly gets full, then the chest lifts. On the exhale, both hands can go in on any way, but I want both hands going in. And if they're not, tighten your tummy to get all the air out on the exhale. So then on the inhale, you have that nice big inhale next. Try to make that breath as long, as deep as possible. And focus on your exhale. Get that exhale so long, creating that space for that next inhale. It's going to take a few more breaths just so you can notice how that helps your body change. If you feel like you have the breath pattern, you could drop both hands down to your thighs. And then just notice again how you feel in your body, how you feel in your space. So we're going to go back to that breathing because that breathing I use for both lymphatics and because lymphatics are part of your pelvic floor, for your pelvic floor. And it's really great when we're working with having gone through cancer treatment, that deep diaphragmatic breathing is huge for helping your wellness and improve function. So cancer and cancer treatment cause dysfunction. Rehab improves function. Please get your own rehab professional. Cancer treatment also affects lymphatics in every way, shape, or form. I'll go through that in a moment. And that lymphatic transport is part of pelvic function. So lymph fluid is just the clear fluid that circulates throughout the body. I'm going to step back real quick and kind of talk about your blood flow. Your heart pumps out oxygenated blood through the arteries. 100% of that blood that gets shipped out, only 90% of that blood comes back through the veins. The other 10% is picked up through your lymph system. Arteries, veins, and nerves and lymphatics all travel together throughout your body. We have a couple different systems we're going to look at, but know that when we are doing that deep breathing, it improves the whole system lymphatically, and it also improves your pelvic floor function. So here's some picture of your lymph nodes. We've got lymph in the breast, all throughout the body. That blue section you see on this drawing's top right side, that is one of the quadrants. So the right side, front and back, head down through the trunk and into the back, that all is just one system, and one, we call them watersheds. And whereas the left side of the body and both legs are in another, and it's based on where it's dumping back into the vena cava. And here is another drawing of all of the lymphatics in the legs. So this is superficial, mainly the superficial layer. It picks up large particles, bacteria, viruses, fungus, parasites, and cancer cells, and breakdowns of inflammation. So that's what the lymphatic system is doing. It's picking it up and bringing it to be processed. In the pelvis here, there's a lot of lymph nodes and lymphatics in the pelvis. And it's very important because we want, we have the lymphatics that's right under your skin. That's the superficial, because we get a lot of, cuts, it's our barrier against the environment about, infectious things. And then also deep in our body, we also have more lymphatics for the deeper arteries and veins, and throughout our gut and our organs to help keep everyone healthy and happy. That's what I just explained, deep and the superficial, and the deep lymphatic vessels in our pelvis are huge and a huge part of our health. And here's just another picture showing a little bit less. I like the yellow picture. I broke it up in half because it just shows we have a lot of lymphatics, and it's just so important. Also really important to note here is that thoracic duct. So exactly in the middle of this slide, you see that thoracic duct, and right below it, the cisterna chyli. This is huge for helping us process our entire system. And when you're doing deep diaphragmatic breathing, it strokes the diaphragm that we just did, sitting in our chairs, strokes the cisterna chyli in the thoracic duct, processes the lymphatic fluid so that there is a vacuum and helps the whole system work better. And I like pneumatic pumps. I think every person who's gone through cancer treatment, who has a lymphatic injury, should get a lymphatic pump, because even though I'm really fun, it is kind of annoying to drive to come and see me, for me to move the lymphatic fluid. I want to get you doing everything at home on your own. So your lymphatics are affected by what you're born with. Like, all of us have some good lymphatics, some bad. Our veins, if our veins aren't so good, that makes it harder on the lymphatics, because the veins won't be taking that 90%. And someone who doesn't have as great of just a family history of bad veins, they might be at like 70 or 80%. So then the lymphatics has to pick up a lot more. Radiation, chemo, surgery, endocrine therapy, all of these affect our lymphatics. And then we can improve by, the lymphatic function by exercise and activity, because our muscles pump against the lymphatics and help stimulate and move the lymphatic, that inherent pump. Hydration, the more hydrated you are, the better your lymph system is going to work. Inflammation, and by that I mean reducing any inflammatory response. So like food sensitivities, if you're just, if you've got some environmental pollutants, ways to reduce our inflammation, wellness, and circulation. So, and this is really where I'm going through, you guys know this, how much radiation affects our bodies and affects how our body is moving. So I'm talking about radiation affects lymphatics mainly, in addition to a lot more. But because our pelvic floor is lymphatics, and that's why I want to tie it all together for you. Chemo, all sorts of side effects, also lymphatic. All of these things, by the way, your rehab professional helps you improve. Surgical, lymphatics. These are all the things we can do to help. So this is a person who has upper extremity lymphedema, and it just shows the changes in the stages. I get really, really, I've said some pretty not nice words to physicians, mainly who don't consider sending out for rehab until there's swelling. And that's ridiculous, because that's stage 2 to 3 is when we start seeing as soon as the arm or the limb or the area feels heavy, achy, or tight, that's when we know the lymphatic system isn't working well. And I want to be involved and not let it get to swelling. This is just a slide on some of the risk factors for lymphedema. By the way, this is not like IV sticks and blood pressure cuffs and carrying purses. So all of those things, it's been found, we're not kind of on, we've changed the risk factors, which is nice, because we don't want you guys to be fearful and not lifting and doing things. We want to really be mindful of what the true risk factors are. For prevention, we're going over skin checking, gentle cleansing, making sure we don't have sunburns, because that's inflammation. It's going to overwhelm our lymphatic system. Bug bites overwhelms our lymphatic system. Some of changes in how we're doing our manicures, avoiding deep heat like hot tubs and sauna, because heat just congests us more. We want to avoid constriction. Injury, like a big constriction injury, and then increasing our exercise. When I am working with patients, I do a lot of manual lymph drainage, which don't tell your insurance. It feels just like a massage. It feels very nice. Then I prescribe exercise, usually with a walking program and some yoga or whatever the patient's wanting to do. I use bandaging and a pneumatic pump. So why do we need to understand lymphatics for pelvic floor? You're like, Lauren, this is on pelvic health. Well, what does your pelvic floor do? Well, guess what? It helps you breathe. You can't breathe without a good, healthy, working pelvic floor. It stabilizes your diaphragm, which is the muscle of breathing. Any kind of trunk stability. So if I were to raise my hand right now, my pelvic floor, we would see if there's an electrode there, seeing what the muscles are doing. As I raised my hand, it would go whoop, because my pelvic floor does everything trunk-wise for me to just lift and move my head. Can't do this without my pelvic floor keeping my trunk stable. Mobility, which means walking. You can't walk without your pelvic floor. In fact, it absorbs all the ground forces every time your foot hits the ground. 2 to 3 times your own body weight through that one limb goes up the leg, up through the pelvic floor. So just the forces that your pelvic floor is absorbing while you're walking is huge, besides the fact that it's holding everything together and doing the movement. So we also, pelvic floor allows for urination. And by the way, it doesn't have to be strong for urination. It has to relax. Your pelvic floor has to relax for urination, defecation, and sexual pleasure or activity and penetration or just orgasm. Doesn't even have to be penetrations for sexual pleasure. And big role is lymphatics. So your pelvic floor, because it's not like open to the out, it's an area that bacteria can get in. So viruses, all of those things, we have a lot of lymphatics to keep this area healthy and to pull any large particles out and get them processed. So here's a nice little informatic of what pelvic floor looks like. On the left is a male pelvic floor holding up the bladder. That looks like almost like a little mouse. And the prostate underneath the bladder. And then a drawing of what the colon looks like, descending colon. And then on the right is a side cut of the pelvic floor holding up the organs in a female pelvis. So we have the bladder in front. We don't have a prostate, so that's why ours doesn't look that little, I don't know, actually looks kind of like the shape of a uterus, but the circle is the cervix. The middle one is the uterus down to the vagina. And then in the last, there is the rectum. So the pelvic floor does everything, absolutely everything. It's an area of great shame. Like culturally, we are like, this place is like gross. You're supposed to like cross your legs and all this stuff. It's bad for you. But it is so important. These muscles are so amazing. And, you know, they're a powerhouse. They literally do everything. And we're told it's gross. And we're told the area is gross and to have shame. The nerve that innervates the pelvic floor, it's called the pudendal nerve. And I don't know if anybody can guess, or is any Latin like lovers out there, if they know the Latin root or the root for the word pudendal is shame. Can't even make this stuff up. So, and there's no shame. Well, Lauren, you're a pelvic floor physical therapist. Aren't you supposed to tell me about Kegels? Kegel, however you want to say. Kegel. His name was actually Arnold Kegel. And this is a picture of the man. So whenever you're thinking of doing your Kegels, you can think of him as a physical floor specialist. I very rarely have my patients do tons of Kegels. I don't. Your pelvic floor needs to be functioning. It doesn't matter its strength. It needs to be able to function, and to function, it needs to be able to relax and contract. And you and your brain need to know if your pelvic floor is relaxing or contracting. So that's that proprioception or awareness of what your pelvic floor is doing. Is it coordinated? If you guys, I'm just going to say, go ahead, do a Kegel. Who, probably a bunch of you probably used your abdominals or maybe your butt cheeks. A true pelvic floor contraction, the abdominals are soft and the butt cheeks don't, they're also soft. Some people like use their eyes to do a pelvic floor contraction, claw their toes, all of these things, because we're just not taught well on how to contract our pelvic floor. So there's that length for our muscles is just huge. And it's a really special muscle because of how the fibers of the pelvic floor are to get length. So it's almost a lot of times when I'm talking to patients, I don't want pelvic floor contractions because a lot of pelvic floors are tight and gripped. So literally you're just going like this and that's not very functional. Or think of like a fist and you're making even a tighter, like, oh, we're just going to squeeze that fist even more. No, to be functional, we need to relax, open, become aware of our pelvic floor, contract, relax. So if you're having any questions, like if you have bowel bladder sexual dysfunction, if you feel like you don't know where your pelvic floor is, or we're going to go through a couple other scenarios, find a pelvic floor PT. We are very, very lovely people. We just want to do what's best for you. And we can do a little bit, we can do very low level stuff, and we can go really, really big. I work with a lot of brachytherapy patients for gynecological cancers, and I can do really, really, really big stuff to help these patients. But if my patient doesn't want to, I don't do any of it. Also very important to know that because stress makes the pelvic floor tighten and not relax, so it's like this, not only do people going through cancer treatment have those tight, not well functioning pelvic floors, but so do their caregivers. And pelvic is not for females, pelvic is not for males, this is for everyone. Everyone has pelvic floor dysfunction. So this is for everyone. Let me just talk about some never evers. Please never ever stop the flow of urine with a Kegel. Please never, ever, ever. And the reason is because that is a reflex that you're messing with. Your pelvic floor muscles, if you think of how heavy, like I can urinate this much water easily. This is quite heavy. As the bladder fills, the tone in my muscles has to increase. That's how your brain knows when you have to pee, is how kind of much tension, how heavy that bladder is getting on your pelvic floor. Increased tone, which is almost like a squeeze, means it sends a message to the muscle that surrounds the bladder, do not contract. When you're walking around with this heavy bladder, it's actually inhibiting that you're not just going to pee because the bladder's full. So when you actually sit down on the toilet, which we're going to talk about that in a second, and you start to urinate, the pelvic floor muscles, when you sit down, relax. And then the reflex says, okay, detrusor, the muscle that surrounds the bladder, you can now contract and let all the water or urine come out through a nice relaxed pelvic floor that allows things to pass through. So if you're squeezing while you're peeing, it's messing with the reflex, and these reflexes, you don't want to mess them up. So I went to my hairdresser once and she was like, Lauren, you're a pelvic floor therapist. And she had, her friends, there are other clients around her. How do I tell what my pelvic floor, is strong or not? And I was like, well, if you really want to know, you can place your finger and put it inside and squeeze around your finger. And she was horrified by it. She was like, oh my God, you disgusting, vile person. Like, okay, I mean, you can use your partner, you can, you can go and see a PT if you want, but I strongly advise not to stop, because she was like, I thought you're just supposed to stop the flow of urine. Well, that messes with your reflex. I don't know you, but I love the fact that I can just sit down and this happens. So like I can urinate without having to think and not all confused. Also, if you're, one of the people that doesn't like to sit down in a public bathroom, that hovering over a toilet seat, your muscles can't relax. So that is also messing with the reflex. So I was just saying, unless if there's like a massive amount of blood and you've got an open cut, like really it's not that dangerous to sit on that gross It's not gross to sit on that public toilet seat. There is something there, maybe a quick wipe, but please sit all the way down, relax the muscles, start getting really good urination and bowel movement hygiene. If you start to have urgency, our body, like running to the toilet, will also feed into leakage. So that urgency will go into urgency incontinence. So work with someone like me who wants to help you improve your function. Because these are all things we could really very easily take care of. Please don't restrict fluid to reduce your leakage, because what happens with that is your body is over 80% water. You're going to be making at least 2 liters of urine from your blood every day anyways, whether or not, it doesn't even matter how much water you're taking in. You will increase the amount of liquid that you're urinating out if you increase your fluid. That is true. But if you are if you're gonna leak urine anyways, if you're having issues with incontinence. And what happens when you restrict your water intake, then the urine starts getting so irritated, it starts getting so concentrated that it will irritate the lining of your bladder, and your bladder will start to contract, and then you'll actually get another different type of leakage. So this is where you please work with someone like me who wants to help you with this and give you all the techniques on how to make sure that that improves and is no longer an issue. And then straining for defecation. Having a bowel movement should be sitting down, having a moment of relaxation, and it just happening. If you're pushing and straining, these are problems. Shouldn't be that way. So we want to help you. And then just talking about survivorship. So acute, extended, and permanent. These are, what I'm teaching to physicians, like what the gold standard is for utilizing rehab. We want to start surveillance at diagnosis. And maybe treatment's needed. Maybe it's not. We usually say, hey, there's no issues. Call us when you need us. We're here. We're easy. We'd love to see you. And then after the initial treatment, months after, that's extended. And this is when I love being involved in treatment, because this is when we're starting to see the issues from all the cancer treatment. I want to be involved because I want you to have a resource when you're starting to have all the feels and like all the, oh my gosh, it's coming. It's like just like hitting you in waves. I want to be there to help you, know that that's normal and help build your army for that. In addition to the PT that we're doing. And then there's permanent survivorship. That's long-term over many years. And it's usually resourcing and maybe treatment. I get maybe tune-ups every once in a while. And that's what we call them. But I come back in for a tune-up. Physical therapy is for thriving. I want you sleeping well, eating well, drinking well, moving well, having great relationships, and having good feelings towards yourselves. You want, the whole goal of this is to help you do the activities you want to do and help you maintain that high quality of life. Cancer treatment, I mean, I've seen people who are like, wow, like I'm so much better after my cancer treatment. I can't even believe I'm saying that. It's really quite remarkable when we can get there. And it's a journey. It's quite the journey. You guys can teach this to me better than I can teach it to you. So now we're going to bring in that breathing again, and I'm going to teach you how to bring the breathing in with your pelvic floor. So back to your chair. Hopefully you're sitting nice and kind of on both sits bones. And if you want, you can actually take your hands and pull your glute tissue sideways. Get those butt cheeks and pull them out to the side, and then you'll really feel your sits bones or your ischial tuberosities, the bone of your pelvis, sink into your chair and ground it. That actually helps bring some proprioception and some awareness of what your pelvic floor is feeling like on the chair that you're sitting on. With your legs, both feet on the floor, go ahead and take your hands, put it on your pelvis. It's your pelvis, not your hip. Your hip is in the middle of the underwear crease. It's your pelvis. So notice if you tip your pelvis forward, like you're really putting a big round in your low back and you're rolling towards your pubic bone, kind of notice how that feels for where you're sitting on the chair. So your pelvic floor area is this diamond shape, pubic bone in the front, and the back is the tailbone, and the two ischial tuberosity sits bones are on the side. So there's this diamond that we're sitting on. So you can roll towards the front of, towards your pubic bone and kind of feel where those tissues are. Your clitoris, is there, guys, I don't know how many guys we have in the talk, but you're going to be rolling, the muscles are the same, just your urethra is out through the front of the body, where ours is coming a little bit more straight down. So you're going to roll forward, and then you can kind of tuck under and roll back. Most women and men because they have tight hamstrings, women because they're told they need to do this tight cross bogus stuff with their legs. This is the most people sit in this area, and it's really bad for your health. It's bad for your head and neck and your back and your low back, upper back, low back, and pelvic health. When you have patterning that holds your pelvis back to front, we have huge, like 2 to 3 times the rates of urinary incontinence as opposed to somebody who could sit more upright in the center. So find that kind of like front to back, find your middle, find your center, or maybe even center more forward, how you're sitting on your diamond. One hand on your chest, one hand on your abdomen. Start to notice where you're breathing. Use your nose, inhale and exhale through your nose as long as you're not congested. And bring that air really down deep into the bottom hand. Big belly on the inhale, exhale, belly goes in. So in the picture here, if you're following the arrows as you're doing this big, beautiful breathing, on the inhale, the pelvic floor actually goes down and is a lengthening moment. I want length in the musculature because everybody's walking around with tight, angry, gritted, not so happy pelvic floors. And that's why they're weak. So on the inhale, imagine your pelvic floor gets longer and drops into the chair that you're sitting in, men and women, same. On the exhale, maybe you think of pulling your 2 sits bones together and pulling the whole area away from the chair. On the inhale, you release, relax, and let everybody sink back down. And on that exhale, maybe you bring those bones together and lift up and in. I like to think of like a marble down there that we're pulling up into our body. But the more important thing is that relaxation and the length. I am only teaching you pelvic floor contraction because it's to give you awareness of the body. Another thing you can do is take a towel and roll it up and sit on a towel that's like a long cylinder. And that'll give you a little bit of input going into your pelvic floor. It can kind of, shorten it also. It could shorten the muscles. It makes it harder to relax. But it's really good for feedback, like a biofeedback, meaning it's telling your brain where your muscles are. So you do that big inhale, you feel the pelvic floor muscles drop into the towel. And on the exhale, there's a gentle recoil away. A lot of people like to hold their breath, or if they have increased pain, or if there's leakage. These are all parts of go see your PT. And then notice when you're doing that up and in, pull in, on the exhale, you're going up and in. Are you kind of gripping your eyeballs? Are your toes curling? Are your butt cheeks lifting you up? Are your abs working? All of these are things that shouldn't be happening. Just a pattern that nobody else really talked about this area or described it. So our bodies figure out other ways to use these muscles, and they don't work well, honestly. So it's all about relaxing. Relax, relax, relax. So pelvic health, increasing your wellness. Breathing is the number one thing you can do to help your pelvic floor. Earlier, when we were just focusing on the breathing, That was all about relaxing and resting. And we're going to do a little bit of yoga, sitting yoga, focusing on lymphatics and pelvic health in a moment. Then we'll take our break and start doing some questions. Breathing is so good for you. When we are going through cancer treatment, we are stressed out to the max. We're in the sympathetic nervous system, which is fight or flight, or we're kind of shut down. That's another one too. So if we can calm our nervous system and really get our bodies nice and relaxed, it gets us out of that gets us out of sympathetic, which isn't very good for us, and moves us into this parasympathetic, which is rest, digest, and heal. So we really want healing during cancer treatment and after. I want you just to kind of be aware of your body. Be aware of how you feel in your body, how safe you feel in your body. When we are scared or frightened, our muscles tense up and they do these patterns that are not good for us. Muscle patterning is huge. One thing I love to do is go ahead and clasp your hands together and just kind of notice, are you left over right or right over left? It doesn't matter. It has nothing to do with your handedness. Your body one day just decided this is the way you're going to clasp your hands. If you unclasp and bring that bottom hand up and reclasp, alternating just the opposite way that your brain has figured out how to do it, this will feel very weird. A lot of times people can't even get it, like can't even clasp their hands opposite. My job is to challenge patterns all day long in patients that come in and their muscle pattern is not working for their body anymore. So muscle patterning, mainly probably the biggest one is gripping in our pelvic floors, because it's a really easy place to throw tension. So getting that muscle patterning, knowing your body awareness, how do I rest, how do I relax? Hydration is key. I mean, tons and tons of water, unless if you have kidney failure, or, talk to your doctor. But the more hydrated we are, the better. And that is even if we are leaking. So increasing our hydration, eating for nourishment. If you're really hydrated, you also won't eat as much, because a lot of times when we get hungry, it's actually because we're thirsty. A lot of our hydration does actually come from food. So that's why I know the thing where I'm like, if you're going to quit drinking so you don't leak, you might as well stop eating too, because you're getting fluid out of whatever you're eating. Finding what do you need for that nourishment, like what makes you feel good, and what things are you eating that your body doesn't like and is causing that inflammation. We need to cut down inflammation. We need to get your body happy and healthy. We want happy urination. We want you sitting down on the toilet, relaxing those muscles, it just happening. Happy bowel movements, same thing, sitting on that toilet, it just happens. It's just a reflex. It's a reflex. It's a pattern that happens until we mess up that pattern. I give everyone walking programs, and I usually give walking programs with friends, caregivers, partners. I want to kind of have some relationship building and some social supports as part of the walking program. Really good sleeping habits. Sometimes we don't sleep well, and that's okay, but if there's ways that we can build up our habits so it can be as good as it possibly can be. And then increasing those social emotional supports, which is really important for our healing and our wellness. This is my email. It'll be in the slides that get emailed out to you. I have a private practice down in Frankfort, Illinois. I've worked at multiple hospitals and have since gone solo, and really, really fortunate. So that's my contact information. And this is when we embrace your happy. And here's a picture of the pelvic floor. It's all of its glory with nerves, arteries, veins. The lymphatics are usually denoted in green. They're not in here because nobody likes lymphatics. It's super, super fun and exciting. So now let's go ahead and get set up nice and easy in your chair. Get those feet on the ground. Maybe you take and pull your gluteal tissue away from your sits bone, ground yourself into your chair. Palms are up on your lap. Maybe you tilt forward towards your pubic bone, roll back towards your tailbone. Notice notice where you're sitting and how you're sitting. Then next, you're just going to check in with your body. Notice if you're holding any tension. And if you are, just notice it. And then we're going to begin to work on that breath again. So bringing your awareness to the very tip of your nostrils there. Start to bring in the air way down deep to your pelvic floor. Inhaling, let that air feel and fill up, letting the pelvic floor drop into the chair you're sitting in. And then on the exhale, maybe have a gentle rock and you feel the pelvic floor muscles come back away from the chair. And if you don't feel anything, that's completely fine. You can just imagine it. Begin to make that exhale longer, 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 longer. Creating that space for your next big inhale. At any time during your day, no matter what's going on, you can stop and you can work on your breath and you can calm your nervous system down. Next, we're going to bring some gentle movement. So on the inhale, I want you to slowly look up. Exhaling, slowly looking down. And you're just going as slow as you can with your breath. We're just starting to wake up the body a little bit. If you have any pain or discomfort, please do less or just go back to the breathing. And your next exhale, come back to that neutral sit. Check in with your body, a couple nice deep breaths. Send that breath all the way down to the pelvic floor. Maybe we thank it a little bit because it does everything and we tend to hate the area. Thank you, pelvic floor. You're amazing. And next, we're going to begin to inhale, looking over the shoulders. And you're going with your breath. Inhaling to the side, slowly exhaling to center. Inhaling opposite side. On your next exhale, maybe come back to center. Hopefully you guys are starting to have a couple yawns, which means your parasympathetic nervous system is rocking. Next, you're going to go ahead, I'll mirror you. So you're going to take your right hand, put it up on your shoulder, right two fingers on the shoulder. Your left hand comes up and over, put it right above your ear if that is okay. So you have a line pointing between the two. On the inhale, let the head go up towards the ceiling, nice and tall. And on the exhale, think of length with that line getting longer. So you're just finding some beautiful length. Maybe you drop the shoulder hand and let that hand sink down towards the earth, kind of giving you that big, beautiful stretch. Make sure it feels comfortable. Don't do anything that doesn't feel good. Now use your breath to bring it right up into that muscle. This is your upper trap, and there's so much tension here in most of us. The hand that's on your head, I want you to go ahead and drop it over to the other ear. And then you're going to use your arms and the strength of your hand to press yourself back up to sitting. And then we're going to kind of change hands, bring two fingers onto the shoulder. Opposite hand goes over to the ear. Inhale, crown of the head floats up towards the ceiling. Exhale, increase the line in between the two. And drop the hand on your shoulder maybe and let that sink towards the earth. Bring all that breath into your upper trap. And taking that hand that's on your head, slide it towards the other ear. Use the muscles in your arm to press your head up. Excellent. Drop the hands back on your body. You're going to need a little space because now we're going to do seated cat cow. So I like a really nice wide leg, wide knee. I'm going to put my hands palm down on my thighs. I'm going to inhale. I'm going to roll towards my pubic bone. I'm going to stick out my chest and lift up. On the inhale, exhale, press back into that scaredy cat position, round your back. And you can do as little, you're just going with your breath, nice and slow. You can do as little of this motion as possible, or you could do as much of the motion as possible. Sorry, that squeaky chair. So I like to slide my shoulders on my rib cage back and forth during this pose. So just feel those shoulders roll. The other thing you can do is as you're going back and forth on the chair, really feel your pelvic floor roll on the chair. This is a really beautiful massage to your pelvic floor. Cheers, making all sorts of fun noises. Then on your next exhale, so we just went forward and back on your pelvic floor. Do a nice wide leg and just shift side to side and notice what it feels like on your pelvic floor, giving really gentle massage. Maybe do some circles. Circle on your pelvic floor, circle back and forth. Maybe do some figure eights. Start to get really wild with those pelvic movements. Maybe do sideways figure eights, so infinities. And then when you're really good, you start doing like letters. So you can write out A, B. We all love ourselves some cursive. Do any kind of letter. You can write anything you like with your pelvis. And then lastly, come back to that nice neutral sit. Nice deep inhale. On the exhale, pull those sits bones together, pull your pelvic floor up and in. And then on the inhale, release and relax the pelvic floor. We're going to do a couple breaths, using the breath to have that awareness. Remember, exhale, you're pulling up and in. Inhale, you're giving big, beautiful length. After your next exhale, relax those muscles back down. Bring your palms back up on your thighs. Come back to that nice easy sit. Notice how you're breathing. Notice how you're feeling. Oh, I just saw a couple of yawns. I'm so proud. That means your parasympathetic nervous system is happy. And then I'm going to bring your awareness back to our, we're right on time. So we're right back to our presentation. And this is where I want to go to the chat. Oh, no messages. So this is question and answer time. So if anybody wants to type in a question or